diagnosis and treatment of cancer. Doctors are improving our techniques. Research workers are finding and reporting more and no individual is alone in the fight against. We will conquer cancer.
Welcome to the threshold, a moment in time in a place where highly complex research in genomics and proteomics, national leaders in science and medicine, the collaboration of local oncologists, and one of the largest, most prestigious medical schools in the world are working together under one roof, conducting clinical trials, orchestrating breakthroughs that will take the form of highly individualized medical treatments, new and dramatically more influential methods for treating breast, prostate, lung, and colon cancer throughout the world. Welcome to a place at the threshold, a place called Harper Hall.
When you hear the word cancer, you think you're going to die. And being diagnosed as having cancer, that was my immediate thought. I mean, I had chemo for 6 months and then radiation treatments, and that was so hard. I couldn't believe that you had to go through all of that to get rid of it.
I went to the doctor and had weird blood tests. And he says, you have leukemia. Leukemia is cancer, and you probably have between 2 and 4 years to live. And you just go numb.
I just didn't have time or the knowledge to think that I could take care of it.
All the thoughts in the world go through your mind about dying, and it's just awful for about a week. And then you gotta say, what can I do to stay alive?
It used to be all patients who were getting chemotherapy went into the hospital because we didn't have very good anti-nausea drugs. And so we had to put them in the hospital, give them their chemotherapy, give them lots of fluids, and basically put them to sleep. And now, over the last 20 years in developing all these anti-nausea drugs, we have people who come to my office, get chemotherapy, get treated with anti-nausea drugs before and after, and go to work the same day or the next day.
It affects so many people. Everybody has somebody they know who has cancer. Bringing together the intellectual capital from both sides, from IU and from Notre Dame, we'll be able to tackle those big problems and translate them down to where they're most needed, which is people and human health.
We both have strengths and emphasis and interest in cancer research, but they're all working together, and that means that Notre Dame can leverage their resources from us, and we can leverage our resources from them, and really develop a program that would be bigger than each of us could develop by ourselves.
Harper Hall will quicken the pace of discovery, development, clinical trials, and the delivery of new cancer treatments.
In the last 5 years, we've gotten more drugs and more treatments and higher survival than we've had in the previous 20 years.
The goal of the researcher is always a therapeutic, something that's going to benefit society. It does a lot of good for the motivation of a scientist to be able to interact with patients, to know that what you're doing could really change someone's life.
You rarely encounter a person who has not experienced breast cancer in their family. About 40,000 women die from this disease. 90% of those women that do die from their disease, it's due to metastasis. ROGTPases are a family of genes that are involved in promoting those abnormal processes that contribute to cancer metastasis. Potentially we could target it and help to improve outcome for patients.
Healthcare providers are this front line in terms of improving people's health, but the tools and the understanding that allows healthcare providers to do that comes from research. Because you can spend a lifetime nitpicking and pulling apart these different processes, but if you're not doing it with the healthcare needs in mind, then we as basic scientists and translational scientists aren't going to reach the end point of improving people's lives and their health.
Most of the classical drugs available on the market target the active site of a protein, but what we're doing is targeting a different site. We're targeting its binding site for the lipid membrane. There currently aren't any drugs available that do this. So it really is a novel area in terms of not only drug design, but treatment as well.
In the advent of the genomic era, where we have the human genome sequenced, we really can look at this and understand all the different genes in the genome, how they interplay with each other. That's really increasing this optimism that we'll get at these answers.
The goal is to improve outcome for patients and not just to understand how this basic science process works.
We have what we call targeted therapy now, where there's a relatively common adult leukemia. We know the basis of that is a genetic transformation. People have designed a drug to target that.
The work of Harper Hall will make a difference.
The drug that put me in remission from leukemia wasn't even being researched when I was diagnosed with leukemia. 4 years later, it was approved by FDA, and it put me in remission in 3 months.
It's a necessity that we have the basic scientists talking with the physicians, trying to understand how we can best benefit the community.
Being exposed to the desires of people to want to fight this disease. I think psychologically there's a calming effect that you know that these people are smart and they want to do it and they care.
Harper Hall is going to symbolize that translational science. We have basic scientists, physician scientists, and clinicians working all together to sort of get the best therapies for patients.
I think a lot of people are going to be alive in 10 years that wouldn't be alive at all if it wasn't for research like what's going to go on at Harper Hall.
Everyone should feel that they're all helping cure cancer. If you live here, you can.
Welcome to a moment in time, a place where research done by national leaders in biology, medicine, the collaboration of local oncologists, and one of the largest, most prestigious medical schools in the world, orchestrating breakthroughs that will take the form of highly individualized medical treatments for cancer throughout the world.
I take cancer very personally. When I went in and I talked to those kids about leukemia, I told them flat out, don't be a doctor if you're in it for the money. I don't want you. I can't use you. You'll kill me. If you're in to save my life, I'll be there. I don't care how young you are, what you look like. I don't.
Welcome to a place at the threshold. A place called Harper Hall.